Set.
During which we will first take questions from our members.
Hello, my name is Gary Cohn. I'm the president of Healthcare Without Harm. Today, we are launching the Healthier Hospital Initiative to challenge the entire healthcare sector to improve patient and employee health, reduce costs, and embed sustainability into the core operating model of healthcare for the 21st century. We understand that it is getting more and more difficult to support healthy people on a sick planet. We have an epidemic of cancer, obesity, diabetes, asthma, and other chronic diseases that threaten to overwhelm our entire healthcare system. A growing body of research confirms these diseases are linked to environmental exposures in our food, air, water, and consumer products. From both an economic and public health perspective, it is no longer viable to simply focus on treatment of chronic disease, which now account for 70% of all healthcare costs. We need to prevent them from happening in the first place. A healthy environment is not a luxury item. It is an essential human right and the very foundation of healthy people and healthy communities. I'm honored to be standing here with representatives of 11 leading hospital systems in the country. Together, they represent over 500 hospitals, which is 10% of all the hospitals in the United States. They are Advocate Healthcare, Bon Secours Health Systems, Catholic Health Initiatives, Dignity Health, Hospital Corporation of America, Innova Health System, Kaiser Permanente, MedStar Health, Partners Healthcare, Tenet Health Systems, Vanguard Health Systems, and also joined by two other NGO partners in this initiative, the Center for Health Design and Practice Green Health. Together, we are inviting every hospital in America to join us in a national campaign to reinvent hospitals as community anchors for health, sustainability, and disease prevention. Generous contributions from the sponsoring hospital systems and philanthropic foundations have underwritten the cost of the Healthy Hospital Initiative. Dozens of leading experts in environmental health and sustainability have contributed to the how-to guides that walk participating hospitals through each challenge. They have contributed critical funding and expertise, and we are asking hospitals to match that commitment with their own by enrolling in one or more of the challenges. Hospitals that participate in the Healthy Hospital Initiative can do so for free. If we can get hospitals and clinics nationwide to accept these challenges, then together we can accelerate innovation and reduce our climate impact, detox our supply chain, and kick our addiction to junk food and sugar beverages. We will teach healthcare leaders how to operate cancer centers without carcinogens and children's hospitals without chemicals linked to birth defects. We will help hospitals eliminate asthma triggers that make nursing one of the most hazardous professions in this country. We will assist hospitals to reduce their consumption of fossil fuels and gradually move toward renewable energy sources. And we will transform the food purchasing practices of hospitals to support farmers' markets, create local and sustainable food systems, and serve healthier beverages. Together with our partners, we have developed implementation packages with proven strategies on the 6 challenges that we will share with every hospital and a clinic in America. These challenges are engaged leadership, healthier foods, leaner energy, less waste, safer chemicals, and smarter purchasing. These challenges are not mandatory, and hospitals can choose which of the 6 they would like to adopt. Our work is not done with simply the commitments of those standing here today. We know that by demonstrating how these hospital systems have achieved successes and reduced costs, we can provide a roadmap for other hospitals around the country to also join and take concrete steps to achieve success and save valuable resources. Over the course of this 3-year initiative, we will expand the number of participating hospitals from 500 to at least 2,000, almost 40% of all America's hospitals, and create a catalytic impact on patients, staff, and communities nationwide. Moreover, we will be measuring this impact by gathering data and metrics from participating hospitals to demonstrate how the entire sector is improving its overall performance. Healthcare represents 18% of the entire economy. If we can aggregate the purchasing power of healthcare, we can lead the entire economy toward renewable energy, green chemicals, safer products, and more sustainable and healthier food systems. We are not waiting on the Supreme Court to decide on the future of healthcare. We are creating our own future that places healthy people, healthy communities, and cost reduction at the center of healthcare delivery. And at the same time, Healthcare Without Harm is also working with hospital systems in England, Argentina, China, Sweden, Brazil, the Philippines, Indonesia, Tanzania, and many other countries to share best practices through a global network as we transform healthcare to lead our civilization to a healthier and more sustainable economy. At this point in history, we are desperately needed to heal not only our patients, but also the environment that sustains us all. I'd like to now call on John Meservey, Director of Capital and Facilities Planning for Partners Healthcare and the Chair of the Healthier Hospitals Initiative. John.
Thank you, Gary, and good morning. Healthcare has a large environmental footprint. We consume one-sixth of the nation's energy. We generate thousands of tons of waste per day, not just paper and cardboard that can be recycled, but medical waste and hazardous waste, things that are often incinerated, releasing toxins into the air. We dispose of hundreds of thousands of electronic devices every year, computers as well as ultrasound machines and others which contain mercury and lead. We purchase huge quantities of building materials, furniture and other furnishings, medical devices that contain chemicals known to be harmful to humans, such as chlorinated plastics, perfluorinated compounds, and phthalates. As Gary mentioned, environmental factors are implicated directly and indirectly in many of the diseases prevalent in our society today. These diseases range from asthma and respiratory ailments to heart disease, Alzheimer's, autism, and cancer. HHI is committed to changing that dynamic. So the proposition is, if a hospital's fundamental commitment is to health, then we have a unique obligation to be leaders in making positive environmental change. I'll say that again. If a hospital's fundamental commitment is to health, then we have a unique obligation to be leaders in making positive environmental change. It means that the Hippocratic Oath of do no harm extends beyond the operating room, the exam rooms, out to the communities that we are part of and that we serve. At Partners Healthcare in Boston, we state it very simply. Partners shall not be viewed as contributing to the health problems manifested in the patients we are treating. We each have stories to tell today about some of the things we are doing at our hospitals to reduce our environmental footprint. Our hope is to encourage other like-minded hospitals to participate with us as we walk down this road together, recruiting, hopefully, all of the hospitals in this country to participate and hospitals overseas. I'm going to talk briefly about what Partners Healthcare is doing in the area of energy reduction. Partners Healthcare is a 12-hospital system in eastern Massachusetts, primarily Boston and Boston suburbs. We consume the equivalent of 42,000 households of energy per year. Now, it so happens there are 42,000 households in the city of Cambridge, right across the Charles River from Boston. The city of Cambridge is the 5th largest city in Massachusetts, with 105,000 residents. So we, in our 12 hospitals, consume as much energy as the residents of the city of Cambridge, the 5th largest hospital in Massachusetts. That is a huge amount of energy. So what are we doing about it? We've taken it upon ourselves to commit to reduce our energy consumption by 25% by 2014. It's a short period of time, but we're making headway. It's not impossible. We're doing things such as turning down the volume of air, the temperature of air in the operating rooms when they're not occupied. We're recommissioning our buildings so that they operate as efficiently as the engineers once designed them to operate. And we're replacing air handling equipment and pumps with more efficient units that reduce that energy use. Our payback on our investment is 3.7 years. Or as our chief financial officer likes to say, it's a 29% return on investment. Now tell me, what legal activity can you invest in that produces a 29% return on investment? So, without saying, energy reduction in hospitals is a tremendous opportunity, not only to reduce the greenhouse gases produced during energy production, but also to save money. Second initiative, I should also say in the first 18 months, we've already been able to reduce our energy consumption by 9%. Second initiative is to transition to more efficient forms of energy production, such as on-site cogeneration, and to reduce our dependence on carbon-based fuels by using photovoltaics and fuel cells. So the point of this example is not to say that Partners Healthcare has this problem solved. We don't. But rather to illustrate that there are opportunities for the healthcare sector to reduce energy consumption, to contribute to improving community health, and to do it in a way that saves money. The HHI Challenge has specific goals related to energy reduction. Each of us sitting up on the stage today, one way or another, has already made that commitment to energy reduction. We think the tools and resources that are available will help other hospitals. As Gary said, they are free. We want you to join us. We want you to use those tools. We want you to reduce your energy. Thank you.
Okay, our next speaker, and I'd like to introduce Knox Singleton, the CEO of Innova Health System.
Thank you very much, Gary. On behalf of Innova Health System, it's a pleasure to be one of the founding sponsors of the Healthier Hospitals Initiative and to be joining you today to share some of our experience as actually a long-time committed institution and organization to environmental issues and sustainability. Innova was one of the first conveners of Environment and Healthcare Conference, a national conference in 1992, along with Modern Healthcare, and brought together interested parties from all over the country. And we highlighted this issue and the alignment between the question of what is our basic mission in healthcare? Are we about healthcare alone, or are we really about health and the community's health? And then secondly, the whole question about how do you translate that mission into practical application within the leadership of a healthcare facility, an individual hospital, or in our case, a hospital system. Well, we've been working studiously on that ever since, and I think it's fair to say we have a lot of experience by this time from 1992 to date in sort of understanding what works and what doesn't work. Oscar Wilde, I think, was the wag who said, "Experience is the name we give our mistakes." So we have lots of experience to share. I think the idea is to share some of the things that worked and some of the lessons today. So I'd like to highlight really the three things that we've learned over those years and we think are sort of central to organizational, actual, applied, practical commitment to sustainability as a part of your mission and as part of the way that you lead and manifest your mission through your daily program development. I'd say our biggest learning is probably that the role of leadership around sustainability is really something that must be driven by a director of sustainability. In our case, we've learned that the director of sustainability really has to be part of the strategic leadership team. In some respects, they're translating sustainability into every strategy and every priority of the organization. I think in 1992, when we started this journey, we viewed sustainability as somehow this separate thing, that it was a standalone component within the things that we were trying to do. And today we have a full understanding that our whole strategy really is health. And at some level, the director, in our case, of sustainability, leads that process of translating our vision of health into the process of our actual strategy. The second thing I think we learned was sustainability is an end in itself, but it's also perhaps a critical means to achieving most of our other business objectives, whether it's quality, safety, cost, engagement of our people, growth of the organization, or community engagement. If you stop and think about it, sustainability runs through every one of those areas of leadership. A couple of examples were given by John about the cost impact. Well, you can also look at the safety impact on your employees and your patients of facility design. You can look at the impact on your engagement with the community when they believe that you're an agent in support of their health rather than just serving the narrow interest of the facility. It impacts, we believe, everything that we do. And then finally, the core operating theory within Inova has really become sustainability, because when you stop and think about it, everything we're trying to do today is to get better results with less resources, less wasted resources, without collateral negative side effects. What is the fundamental notion or concept of sustainability? I would argue that is our fundamental concept of organizational performance. We believe that that is at the heart of the way that we have to lead the organization. And looking back, when we see what's worked and what hasn't worked, our two keys to success, we're fond of saying, is that you've got to engage your organization in sustainability as a goal, and you have to engage in the program. We believe it has to be at the very top and at the very bottom of the pyramid. If you don't engage the very senior most executive leadership, anything you do down below will basically sprout, but it will quickly wither and won't be sustained. If you just engage the senior people and you don't engage the folks at the grassroots, the roots will not go deep in the organization. They won't go into each department. They won't go into each operating unit, each team viewing sustainability as part of their goal. We believe the middle will kind of come along. If you anchor it at the top and you engage everybody at the bottom, it will sort of grow together in a top-down, bottom-up combination. The other key to success, I think, is that we really look at every program that's developed around sustainability as having to serve a triple bottom line. A triple bottom line to us means it has to contribute to our cost and resource waste objective. It has to contribute to some general organizational objective, and then it has to have an environmental return on our efforts. So a triple bottom line of usually finance, organizational priority, and environmental ROI. If you think, for example, we have our Healthy Sustainable Foods program in our cafeterias. At the environment, obviously, that drives our Buy Fresh, Buy Local farmers markets, basically developing local sustainable food sources. But when you stop and think about it, what does that do for your employees? For us, the strategy is employee engagement. We found it's a marvelous way of engaging employees, and employees are much more engaged when they see your sustainability strategy played out in their cafeteria. And then finally, obviously, it reduces the cost of our health benefits. If we have healthier employees who are eating healthy and developing that in conjunction with other lifestyle improvements, we see a direct cost ROI in terms of their lost time from work, their time that they spend away from the job and using healthcare. Another good program that we've seen having that triple bottom line is reprocessing of disposable supplies. We found that from an environmental point of view, we could reduce over 4 million pounds of waste, which is some large number of hippos worth of waste. I'm not exactly sure how many Seema knows, but it's a very nice reduction in our waste target, or contribution toward our waste reduction target. But the second thing is that it builds a lot of employee pride. They love being able to contribute to that process of identifying and bringing back the reusable and recyclable, theoretically disposable parts. And then finally, the CFO is delighted we saved over $1 million in the first year of the program. So it's a triple bottom line for us, an environmental ROI, targeting one of our key objectives of employee engagement, and then finally giving us a big ROI on our cost. Our theory is that we have to bring that triple bottom line and that focus at the top and the bottom to all the various areas. And we work on safety, quality, service, our patient experience, We work on the engagement of our co-workers, the growth of the organization, and our community roots and the quality of our community relationship. We really think that this effort to reinvent American hospitals as agents of health, not just agents of healthcare, is really the future, and we're very committed. We commend the leadership that has been shown by our colleagues and by the leadership of this important initiative. Thank you for the opportunity to share with you our experience today.
Our next speaker is Kathy Gerwig, Vice President of Employee Safety, Health, and Wellness, and the Environmental Stewardship Officer for Kaiser Permanente.
Good morning, everybody. I'm just thrilled to be here to participate in this event. I'm excited about the Healthier Hospitals Initiative because healthcare is a team sport, and everything about healthcare involves a team. And I think what you'll be hearing about in terms of the Healthier Hospital Initiative, and I hope what we're communicating to you, is a really full commitment to the profound work that we have underway. What I wanted to do was tell you a few stories, 3 to be exact, that sort of, in my mind, exemplify what we're trying to do collectively. So let me start with one that you think about in healthcare. Think about if you're in a hospital. IV bags, IV tubing. It's something that pretty much everybody who visits a hospital has experienced in one way or another. And through a sourcing effort at Kaiser Permanente, we realized that the IV bags that we were using had chemicals that were not the most environmentally preferable. As a result of this supply chain effort, we were able to recently sign a contract for IV bags and tubing that don't contain these chemicals that are of issue to us. So what we have now are environmentally preferable products in all of our hospitals. And you know, the fact that we can do that eliminates so many pounds of waste, so much creation of the chemical content of these products. And the best news, as you've heard from some of the other speakers, is this contract actually saves us money. So it's smart for business, great for the environment, great for our patients. So that's a medical setting. What we do here, though, in hospitals, you don't just buy medical products, you buy lots of other things. And something else that we buy a whole lot of, you're in a place right now where you see we optimize technology at Kaiser Permanente. We buy a lot of computers. So our computers are EPEAT certified. EPEAT is a type of certification that means that the computers don't contain certain chemicals of concern and that they are very energy efficient. And our purchase of these EPEAT products is cost neutral. But over the life of our use of the product, because we save so much energy, they actually save us money. They save us about $4 million a year. So we're finding that looking at the cost of ownership as we look at sustainability is an extremely important factor. And then I wanted to mention a third thing that is really a tool that we developed that is widely available now throughout the healthcare community, and that's something we call a supplier scorecard. So this scorecard is a tool that we use during the sourcing process. And when you are about to buy a product, we require the supplier to tell us on a product-by-product basis, at the actual stock level basis of a product, to tell us if it has certain chemicals of concern. We also ask about waste and recycling. We also ask them some corporate level questions. That information is tallied as part of the decision making that our sourcing teams do when they're selecting a product to use in our hospitals. We spend about $1 billion each year just on medical products, and that's what we're applying this scorecard to. The success of that has really been amazing. First, I think among the teams, it allows the teams to very objectively consider how to think about environmental health and environmental considerations as part of any supply activity that they're undertaking. And it has made a difference. There have been products that the competition met, all the quality, all the cost, all the service requirements, and the distinguishing factor was the environmental piece. So internally, our teams of sourcing folks have been really thrilled to be able to incorporate this information. It's made a difference, and we've made that tool widely available through the partnership with the Healthier Hospitals Initiative and Practice Green Health. So you can go on the website and get access to that tool. We're sharing it broadly, and that to me exemplifies the promise of the Healthier Hospitals Initiative. It's that collectively, as a team, we can make so much more of an impact. You know, who would not want to take the opportunity today to reduce health risks? And who would not want to take the opportunity today to reduce health costs? And that's what we're talking about. This work, health risks will go down, health costs will go down, performance will be accelerated, and that's because of the work that the Healthier Hospital Initiative is undertaking. So thank you very much for being here.
Okay, our last speaker is Brad Perkins, Executive Vice President of Strategy and Innovation and Chief Transformation Officer for Vanguard Health Systems.
Thanks, Gary, and thanks all of you for being here today. Vanguard is committed to creating lifelong relationships with people by fundamentally changing the way that we think about and deliver health and healthcare in the communities we serve. Today is a really important day for me personally. In 2009, I left my position as Chief Strategy and Innovation Officer at the Centers for Disease Control and Prevention to join Vanguard, a hospital company, in an effort to grow a health company out of a hospital company. Basically bringing together the disciplines of population health with clinical medicine that for too long in this country have been apart. The Healthier Hospital Initiative is a fantastic representation of the coming together again of those fundamental perspectives. At Vanguard, we're working through a series of quantifiable objectives to measurably improve the health of our employees, to measurably improve the health of our patients and their families, to measurably improve the health of our communities, and to measurably improve environmental sustainability. As a physician and as an alumni of the Centers for Disease Control, I've dealt extensively with the dual epidemics of diabetes and obesity. It's one of the major threats to not only the health of our country, but to the fundamental economic sustainability of our country. We have developed some experience around implementing healthier foods and healthier beverages in a number of our facilities. Some we've, for all intents and purposes, completed the food challenge. On the way to full elimination of sugar-sweetened beverages. We want to make, along with my distinguished health system colleagues, we want to make those tools that we've used and those experiences available to you. You know, public movements are born of private dilemmas, and all of us are struggling with how to eat better and how to exercise, how to stay fit. Vanguard is committed to changing our environments and all of our facilities in ways that the healthy choice for food and beverage is the default choice. And we're committed to do that at our system level. We're committed to sharing those tools with you along with our colleagues in all of the areas of the Healthier Hospital Initiative challenges. So thank you.
Okay, so now we're going to take questions. First, we're going to hear from those who are here live, and then afterwards there are a number of people that have called in that are on the line that we'll hear from. So are there questions of any of us from the audience, any of the members of the press or others? Does he need a mic?
What are some of the, give us a few more examples of some of the biggest things that you're seeing that are reducing energy use, either at your hospitals or other hospitals you've seen around the country? I mean, is this a lot of little stuff, or there's some big stuff also that has an impact?
Well, I gave some examples. I think, obviously, working on the big pieces of equipment that feed air and heat into a hospital is the place to start. So there are big issues, big air handling units on the roof. There are mechanical pieces of equipment, electric drives, things that push water, push air, fans, those kinds of things. There are control systems, electronics that control the heat and humidity in buildings, all of which are very important to maintain in their original design performance level. Typically what happens in hospitals, if a physician or somebody calls up and says, I'm too hot, I'm too cold, somebody in the maintenance department will go and make an adjustment. And over the course of several years, the entire building could be completely out of what's known as balance. And that's where the problems lie. That's where we end up using much more energy than we need to. At the other end of the scale, on clinical equipment, there's an interesting story there. A typical hospital, especially an acute hospital, tertiary hospital, 20 to 25% of its energy is used in what's known as plug load. It's equipment, be it computers, be it MRIs, be it ultrasound machines, and a lot more of that equipment is migrating to the bedside. So at Partners Healthcare, even though we are very aggressively pursuing conservation, we're seeing our annual energy consumption increase on the order of 1 to 1.5% per year because of the migration of electronic equipment into the patient environment, the direct patient environment. And this is an area where there's very little comparative information. There's not an Energy Star version of an MRI. There's not an Energy Star version of an ultrasound machine. And the perfect case in point is our clinical labs at one of our hospitals was looking to replace an $800,000 hematology analyzer. And they brought it down to 2 finalists. From their point of view, either one of these machines could do what they wanted it to do, could perform as well as they wanted it to. And I asked the chief of the labs, well, have you considered how much energy they both use? And he wrote back a couple of days later and said, one of them uses $3,500 more power than the other one. And he said, on an $800,000 buy, that's inconsequential. And I said, no. One of them uses 22% more power than the other one. So if we start looking at the different amounts of power that the machines use that can otherwise do essentially the same job in our hospitals, it's just a perfect opportunity to start reducing, again, energy consumption. So I think there are many opportunities, and obviously use of individual training, the people who use machines, turning off computers, those kinds of things all help.
Another question?
Ben Fisher from the Washington Business Journal. I wanted to follow up with you specifically, Knox, on the fresh fruits and vegetables, the farmer market program. And you said that you were seeing an ROI on benefits costs, and I was just hoping you could shed a little more light on that, because benefits experts I talk to say it's really tough to demonstrate that direct correlation downstream to claims with your employees. So tell me more about that.
Well, I think while the correlation is not exactly directly line of sight, the evidence today is pretty, I think, pretty well to the point where basically lifestyle management of your employees, healthy eating, exercise, stop smoking, et cetera, is sort of the core strategy for reducing health benefit costs. In our case, we have a couple of different components that having a significant corporate health program that works with area businesses, but also applies the health risk assessments, the structuring the benefits to incentivize sort of the experience design that was referenced earlier around the healthy eating choices and in your cafeterias. And one of the I would tell you that probably it's less, each of the parts of the program contribute different components to the triple bottom line. I think the buy fresh, buy local and the farmers markets probably contribute more to the employee engagement side than to the hard cost ROI side. But we're really looking for opportunities to connect not just what we're doing at work, but to help employees connect that principle or that healthy living or healthy eating principle when they go home. Because if they have a great healthy meal with us and then go home to the triple order of fried chicken, et cetera, you know, you haven't won any battles there. So not every component of the program has to contribute to every element of the bottom line, but taken together, they need to feed that triple bottom line that we're looking for.
Kathy?
You know, I just also wanted to offer another example of cost savings. So the Healthier Hospital Initiative, one of the reasons Kaiser Permanente is so invested in it is because it's not just about environmental sustainability. It's about patient safety, worker safety, and environmental safety and sustainability. And this is a great example. There's very solid evidence that overweight and obese workers are more prone to higher workers' compensation costs because they get injured more easily. And so where we can provide good programs that involve sustainable food, locally grown food, and it's fresh fruits and vegetables at farmers markets, not only does it do all the things that Knox was saying, but it also can really help drive workers' comp costs down.
Other questions? Yeah. So, operator, do we have any questions in the queue?
Okay. At this time, we'll begin the Q&A session for reporters only. If you are a reporter and have a question, please press the number 1 key on your touch-tone telephone. Okay. We have a question from Julie Mendo with, please go ahead.
Hi, I'm with Catholic Health World, and I thank you for taking my question this morning. I wanted to know how this fits in with previous initiatives of this group. I know you guys have been together for a while now, and I'd like to know how this fits in with what you've previously done. Thank you.
I'll take that. A number of the hospital systems that are sponsors have been traveling on the path of sustainability with Healthcare Without Harm for the last 16 years and have done a lot of work in their institutions to improve their overall environmental footprint and drive the marketplace towards sustainability. A larger number of hospitals, in fact 1,100 hospitals, have joined Practice Green Health as a membership organization to work on their individual sustainability initiatives. So there's been a broad set of organizations that have been taking up these issues over the last 16 years. What's new about this is the idea of aggregating the power of all of those systems together and all the participants to measure together our progress, to provide for free the sort of best wisdom and case studies and examples that we've been able to gather over the last 16 years, and accelerate the whole sector forward. So in the same way that Don Berwick and the Institute for Healthcare Improvement launched the 100,000 Lives campaign and embedded quality healthcare measures into healthcare, we are going to do the same thing around sustainability. So that's what's really, really new here. And also there's an opportunity to create a global learning community, because the same kind of innovation that you hear from the participants on the stage is happening with the National Health Service and happening with the Vienna Hospital Association and the Stockholm County Council and many, many other systems around the world. So there's an opportunity to create a global learning community so we can learn about what the future of healthcare looks like in the 21st century and how can we build more resilient healthcare in a planet in an environmental crisis. Other questions from folks on the phone?
Our next question is from Ann Brock with Flower Sack Mama. Please go ahead.
Hi. Could you specifically restate how your initiative addresses making the hospital environment safer for infants and young children who might be the most sensitive to chemicals of concern today?
Sure. You know, one of the areas that we're focused on is around safer chemicals, and we know that many of the chemicals have the most profound health effects on infants and young children. And many of us that have been in this work for a long time have focused on trying to examine how we can improve the performance in our neonatal units, for example. So at Kaiser Permanente, we more than 10 years ago began an initiative to look at the products used in the neonatal units just for that purpose, to be able to identify where we could make a change. And we have been on that journey successfully now for a long time. But new products keep getting introduced. And given the current regulatory environment, there's no way to prevent new chemicals of concern from coming into our hospitals and our neonatal units unless we are very proactive at having a system like the scorecard that I mentioned where we can target chemicals of concern in that way. And I think it's a good point. Another reason why the collective effort of the Healthier Hospitals Initiative is so important. It's one thing for a Kaiser Permanente or any of the other sponsoring organizations here to take that action. It's an entirely other thing when we can say, how about if we all share our tools around how we're reducing new chemicals from coming into our neonatal units. It's the only way to really overcome the inundation of information and products that we see in healthcare all the time. So I thank you for that question because it is, one of the most vulnerable populations, and I think HHI is very well positioned to make some significant change there.
I would also add that through the Healthier Hospital Initiatives, we're redefining what community benefit means and supporting hospitals to make investments in initiatives in the community that will support environmental health in the communities that they serve. So that in the past, I think a lot of community benefit expenditures have been to provide uncompensated care and to do clinics around flu shots and other things. But there's increasing openness in the IRS, actually, to allow hospitals to go beyond the four walls of their facilities and to support the healthier communities. So it's a very significant change. Other questions?
We'll now open questions to all participants. Please press the number 1 key on your touch-tone phone if you have a question. Okay. Our next question will come from Tamer Khan with Ascension Health. Please go ahead.
Hi, thanks for this call. It's been really enlightening so far. I did have one question, actually. One of the most difficult things to change when trying to establish healthy habits in food is the behavior of the consumer. Patients, families, hospital employees sometimes just want pizza instead of the chicken breast. How do we how do we maintain or increase retail revenue while also promoting healthy food without so much forcing it?
This is Knox Singleton from ANOVA. I think part of the concept really has to be that you can't coerce or force people to make choices, but you can design the choice experience in a way that encourages the default option to be a healthy choice. I think it was mentioned earlier that a core principle of trying to design an experience for your patient or for your coworker in the hospital is going to be to, when confronted with alternatives, to present those alternatives in ways that encourage and lead them to make the healthy choice. The reality is that a substantial percentage of the time, folks won't make a choice at all, and if the default really ends up being a healthy default, you can you can raise by very large levels the amount of engagement and a connection with the healthy choice that you're trying to promote. There was a recent book called Nudge that talks about how you can craft and design experiential choices around healthy objectives, in our case, sustainability. And those choices can lead to more energy efficient choices with respect to how they evaluate and purchase equipment. It can be food choices, but it's basically the science of designing and engineering choices that promote the organizational and societal outcomes that are often better for the individual as well as society at large.
I would completely agree with Knox's comment about sort of choice architecture. The other thing is hospitals and healthcare systems have the opportunity to set new social norms and be highly influential in the process of doing that. So in addition to architecting choice to encourage healthy choices as default, I think setting a new social norm for eating and consuming healthy beverages is a huge opportunity to shift the conversation and behavior.
I just wanted to make one interesting point is that there's a hospital that has been a leader in sustainable food purchasing, Fletcher Allen in Vermont. I think 45% of all of their food is locally sourced. And it's gotten to be such a delicious experience that now people in Burlington make reservations to go eat in the hospital for dinner. Who would have thought such a thing? Question over there.
One comment where you talked about reducing junk food and increasing food. I guess I keep thinking about all these hospitals over the last 20 years that have put McDonald's in their lobbies. Is this something that's you think needs to change?
I
Yes.
think.
Oh, are you going to go?
No, go ahead. No, go ahead. Better from you.
Well, absolutely, that needs to change. And, you know, we all understand the complexities of the food industry. There is no easy answer. You know, the reason that locally sourced, pesticide-free salad in some cases is seen as unaffordable, you know, there are lots of complicated reasons for that. I think what we can do is sort of what you've been hearing about, which is, number one, change it from where we stand. So when you come into our hospitals, one of the areas that the Healthier Hospitals Initiative is working on is to change that dynamic. So maybe we price our salad bars to be the most affordable food. Maybe we get rid of sugar-sweetened beverages and deal with the upshot of that in the context of health. I mean, nobody wants their choices taken away. You know, we're all addicted to salt and sugar and fat. I mean, that's the nature of, you know, how the food industry has sort of proceeded. But we're about health, so we can take a stronger stand. And it can't just be about the money in the cafeteria. It can't just be about vending machine revenue. It really has to be about what does it take to be healthy, and eating well is part of healthy. Being a healthy weight is part of healthy. It has so many other connections. And I think the promise that we can bring to it collectively is to make sure it's not just about healthy food, but it's about sustainably grown, sustainably sourced, environmentally friendly food. And all of that creates a healthier environment. So I really do feel like we have an enormous opportunity, but it's a great example, again, of what has to happen collectively across the healthcare system, because we all, you know, marvel at Fletcher Allen, and they're one fantastic organization that has huge successes. We all want to be that, and I think that's part of what we want to do through HHI.
And I might add one innovation that we've seen in this space. I mean, clearly there's a demand for convenient food. And as we started doing cooking demonstration classes for some of our diabetic patients, they started asking if we could prepare meals to go for them. And actually, in 2 independent situations, we've started to do prepared meals to go as a new revenue stream for our hospitals, builds relationships with patients, and gives them a healthy alternative to some of the other more unhealthy fast food choices.
I-
Yes.
I'd like to add one point to that. I think when it comes to the potential of leadership, particularly senior leadership, to redefine an important social norm, one of the opportunities that senior leaders have really is to sort of change the whole way that we think about healthy, locally accessed, sustainable food versus a fast food restaurant in your lobby. Not speaking to any particular fast food restaurant, but I mean it's the rough equivalent of putting a bar in your addiction treatment center. And if leaders can't redefine the way that the social norm around how we live our mission, that's a great place to start.
Other questions? Anybody online?
We have a question from Kathleen Fagan with OSHA. Please go ahead.
Thank you. I think this is a really exciting initiative, and I applaud all of the hospital organizations that have joined. I'm interested in the impact that this initiative might have on worker health and safety, and I wondered whether anyone is planning to collect data on healthcare worker injuries and illnesses, and if so, what will they be looking at?
This is Kathy from Kaiser. One of the reasons that we really appreciate the work of the Healthier Hospitals Initiative is because there is a worker safety component. And I'm sure all the systems involved collect lots of worker safety data today. It's you know, as you certainly know from OSHA, healthcare is one of the most hazardous occupations in the United States. We all tend to have relatively high injury rates, especially among nurses. We know that the nursing population is also aging. So as you play out that dynamic, it's important to take care of all workers, and it's especially important to make the workplace as safe as possible for clinicians and all our healthcare providers. So I think you could point to every single one of the 6 areas of focus for HHI and say there is a connection there to worker safety. If it's about safer chemicals or cleaning chemicals, that's a worker safety issue as well as a patient safety issue and environmental. Food is another example. Purchasing, as we think about, you know, it's not just about the chemicals in products we buy, but how heavy are they? What are the mechanisms, you know, or the ergonomic issues? So I think it's the worker safety elements are, we're in a position to have them weave through all of the HHI challenges, and we certainly at Kaiser Permanente are going to be tracking that very carefully, and it's another example of as we report our data and can provide it to folks like you in an aggregate form, it will tell a story. It will tell a story that I think is going to show that when you focus on sustainability and you focus on worker and patient safety together, that you'll get much better results in an accelerated way in all 3 areas.
Colleen?
Scanlon from Catholic Health Initiatives. Well, we're very glad to be a part of this initiative, and we have a very exciting goal to have more comprehensive engagement in the healthcare community. How do we plan to go around about that? How do we plan to grow from 500 to 2,000, and what can all of us do to help?
That's a great question. Well, we have a number of networks that we're going to be building off of to try to get the word out, including Catholic Health Association, the new Children's Health Association, partnering with the group purchasing organizations like Premier and Novation and Health Trust and MedAssets and Amerinet, who represent $135 billion of purchasing, so they can also reach out to their thousands of hospitals through the American Hospital Association, hopefully, and the state hospital associations. We've learned a lot about how to do the outreach from the Institute for Healthcare Improvement in terms of how they developed partnerships with all sorts of agencies in the healthcare sector. So those are some of the ideas. In a month, we'll be having our Clean Med conference in Denver, where there's 1,000 people that come, and one of the goals of that conference will be to walk the participants through each of the challenges and how they could move forward on that. But my goodness, we certainly could use all the help we can get including from the government, from the EPA, from Agency for Healthcare Research and Quality, from HHS, from CDC, from the State Department. So we're looking for every partner that we can. I think there's something here for everyone, and so it gives us a lot of opportunity. We also are getting the support from the American Nurses Association, the American Public Health Association, talking to the American Heart Association. So hopefully this becomes a huge wave in American society that we can reach out to everybody. And if they want to participate, they'll be able to. Yes. Let me get to that. Thank you, John. So a couple of things. There'll be, today we're also launching a revamped website, which will be a resource-rich portal for engagement, support, and information. That's at www.healthierhospitals.org. We're also involved in the social media space, so you can follow us at Twitter at HHI.org and on Facebook at facebook.com Healthier Hospital Initiative. I'll say also that we've tried to demonstrate through this event itself that we're trying to practice what we preach. So all of the press materials are on these little thumb drives instead of paper. All the posters are on sustainable materials. The water is in pitchers instead of bottled plastic bottles. The food, which we're going to invite you to partake of, is delicious and from local farmers. And the space that we chose is the Kaiser Center for Total Health, and is a fantastic LEED certified building. So in a minute, I'm going to ask you to proceed to the other end of the building, where you'll have a chance to explore the real hands-on changes that hospitals are making through different stations, looking at the different challenges. It's an exciting show and tell and brings everything we discussed here to life. There's a lot of great materials that we'll be working on. But before that, I just want to recognize the other sponsoring systems in the audience who have taken the time to be here today, but also, more importantly, to be part of the leadership in making sustainability a standard part of how hospitals achieve quality and cost savings. So at least to just ask the people who are in the audience to just stand up when I call your name. David McComb, Bon Secours, Colleen Scanlon, Michael Romano, Catholic Health Initiatives, Holly Norris, Hospital Corporation of America, Carrie Rich, Innova, Suzanne Patton, Joy Lewis, Catherine Brosina from Kaiser Permanente, Frank Weinberg from MedStar Health, Whitney Austin Gray from MedStar Health, Aaron Griffin from Tenet Healthcare, Amy Collins from Vanguard Health, Deborah Levin from the Center for Health Design, Laura Wanger from Practice Green Health, Seema Wadma, who's the director of Healthier Hospital Initiative, and Janet Brown, who's the director of Content and Outreach, and Sherry McDonald from Practice Green Health. And also, I'm missing Mary Larson from Advocate Healthcare. Thank you all so much for your hard work and for being here today and launching this initiative with us. So now, I'd like to invite you over to the other side where you can have some sustainable food and drink and continue to talk to the people that you've just, who've stood up, as well as our colleagues here around this initiative some more. So thank you so much for coming today. One second. I'm wondering if the people who I just called could just stand up here. It's like a wedding, so we want to take a picture. Something my aunt would have done. Just come up just for a minute.
right about now.